we are seeing 12 methods of contraception. We are now on part 2. We have seen part 1, the main methods, which are mainly surgical. Let us see now the other methods. Okay, these methods, they are mainly on the uterus, female reproductive system, where some will work in the uterus inside, others will work on the ovary, others will work in the vaginal canal. We have seen the one on the males, where we need it now to know where we need to do the vasectomy, which is part which is proximal to the testis, so that you leave prostate and seminal vesicles functional. So injections are methods that are used for contraceptive preventing pregnancies. They are very effective at 99%. They help on preventing the release of eggs from the ovaries. They also help on the thickening the mucus from the cervix, so that the sperms cannot pass. And remember, there are different types. There are those you give for 2 months or 3 months, and we remember Depo-Provera is commonly used, and it is working well for those who use it consistently without having some gaps in between. Tablets are very good as well, but they need to be given on good indications, and the patient or the person using them should be taking them on a regular basis. And the effect is about preventing the release of the ovum from what? From the ovary. They also do the thickening of the mucus within the cervix. They also cause the changes on the endometrium, the inner membrane in the uterus, so that the implantation cannot even take place. The patch, the small device used to attach on the skin, which will be releasing hormones deep inside the body. So these patches, they are effective at 99% as well, because they will be releasing hormones that will be preventing the ovary to release the ovum, which will go for fertilization. They work the same way as the previous methods, tablets and injections. Now, once you have been taking the tablet, maybe it happens that you forget, you can now use plan B, where you take this emergency contraceptive. You take this tablet. However, once you have conceived already, it might be useless. And the effectiveness of this method is between 60 to 90%. Vaginal ring, it's another method where you take a ring, you insert in the vagina. It will be releasing hormones, which will be preventing the conception, and it is effective at 99%. You can leave that ring in the vagina apply to the cervix for 3 weeks, then you remove it, then you change. This is how it will be applied. It will enter in the vaginal canal, and it will come eventually to the cervix. This is a ring. It's very effective as it is releasing hormones progressively. Then the condoms that we know very well, they are commonly available, distributed. There is female and male, and the male will work at 98%, while the female is around 90%. So all of them, they work by preventing the progress of spermatozoa going to the uterine cavity. Here is a female condom being introduced in the vaginal canal, and it has a ring on top, and the lower part will be closed. So the other one is this, the male condom, which eventually has this part which will be like a containing semen after ejaculation. So then it will be eventually discarded afterwards. Then there is another one which is used as a chemical, okay, we call it vaginal spermicides, which will eventually make the environment not conducive for the life or sustainability of the longevity life of the spermatozoa. Once they are in the vaginal canal and they emit this chemical, they won't survive. So, and the other method is now to calculate, to know the calendar as a woman. Remember, when you see blood, on the first day you see blood for menstruation is called day 1 of your cycle. So as you count till day 14, day 14 is a day normally the egg will be released from the ovary. That is ovulation. That time is the time of conception. It is a time of fertility. Now, to have a margin or a gap where you need to know this is a more probability of conceiving, you can start from 12 till 18. This week the conception is more likely. So as now you have your thermometer, you check your temperature, you will find that the temperature will be going higher compared to other days. That's another method of checking. We have seen in short the methods of contraceptions, surgical and non-surgical. However, all of them are given on good indications. Once you have any concern, any question, please talk to your doctor. He will or she will advise you on which method to use, which will be better for you. Okay. So the other thing is always ask questions. There are health professionals available to provide information for you, because what we should be aiming is to have continuous health education and health promotion.